Thank you for staying with us. Like many other countries, Nigeria is striving to end HIV/AIDS as public health threat by 2030. Currently, the country has about 1.9 million people living with HIV/AIDS and about 1.6 million on treatment. The federal government is now taking critical steps by involving community leaders to champion services provided and ensure access to HIV prevention, treatment, care, and support. However, the Director General of the National Agency for the Control of AIDS, Dr. Gambo, noted that although Nigeria has made significant strides in the fight against HIV/AIDS, there is still much to be done. Well, joining us now to talk on the recent development is Dr. Gambo himself, who is the Director General of the National Agency for the Control of AIDS. Good morning. Thank you for joining us on TVC Breakfast.
Good morning. A pleasure to be here.
Right. Let's begin with how much progress we have made so far, say the last 2 decades. You say that we have achieved so much, but there is a lot still needed to be done. So talk to us about the progress we have made and the bottlenecks that you encountered that is making us still have some issues to deal with.
Thank you. You see, coming from where we started about 20 years ago, where we started the active program within the community and in our facility, making sure we provide access to Nigerians to treatment services and prevention services. I'm happy to say that we have made tremendous gain because the entire goal of ending AIDS rests around finding people that have the disease, making sure they keep the virus within them and they don't give others. Recent development has shown that the best way to do that is finding them and making sure you maintain and sustain them on life-saving antiretroviral drugs. And this is what we were able to achieve. It may interest Nigerians to know that out of about 1.7, 1.8, and maximum 1.9, that we think Nigerians having the virus and living within us, we've successfully identified close to 1.6 million that are now taking this medication and are keeping this virus within them. So ending AIDS is real and is happening. And what we mean by ending AIDS is that by the year 2030, we will not be seeing people dying from HIV and AIDS. We will not be seeing people occupying our hospital beds because they have AIDS. We will not be seeing people moving in our streets with AIDS showing in their face. It's already happening. If I may ask this question, when last did you see somebody that has died of AIDS, somebody that is close to you or even not close to you? Or when last did you see somebody moving in our street, on our street, and they said this individual has AIDS, or someone occupying our hospital beds? So this is the direction we're moving, and it's the direction that we are very hopeful by the year 2030 we will achieve. So that is one. Second, achieving that goal is not alone in itself. After achieving that, then it needs to be sustained. And this is what we have started actively working for the last 2 years. Sustainability of HIV response beyond 2030. Currently, HIV services is largely provided by donor. 90% of service money that is used to fight HIV in Nigeria is provided largely by the United States PEPFAR program and the Global Fund. This money, as we know, is not going to stay forever. There is the urgent need for us to mobilize our structures, and these are state structures and structures at local level, primary healthcare facilities, secondary facilities, and tertiary facilities, as well as our additional structures in the community to start taking over from the donor-provided services to services that we can sustain and we can provide beyond 2030. And this is what has been started, and this is what you will be hearing for the next 2 years. When we call a new business model, when we talk about sustainability, when we talk about putting state in the driver's seat, that is exactly what we are discussing, what we're aiming to discuss. And this is the path we're going to follow for the next 2 years. And after that, we'll be happy to tell the global community that Nigeria is ready to end AIDS fully by the year 2030. Thank you.
Interesting. You've actually you started talking about the statistics and some of the initiatives that you are bringing up on board to ensure that Nigeria tackles, end the scourge of HIV and AIDS epidemic by 2030. But all the same, could you talk to us about some of the challenges mitigating against some of these initiatives that you're bringing on board?
Well, some of the challenges are challenges to do with the society itself. One, HIV is a highly stigmatized disease, and people don't assist and help people living with the disease. And because of that stigmatization and discrimination against, people hide. And you know what? When people hide, they keep the disease with them and they keep on giving the disease to others. But if they come forward and take our medication, if they come forward and listen to our programs, if they come forward and be provided by the services we have for prevention, they will be stakeholders in the fight. They will help to prevent others from having the virus, at least from them, and they will help to also keep themselves healthy. And this virus will not show in their face. This virus will not affect their productivity because they won't be sick, and this virus will eventually not kill them. But, stigma is still there. I can tell you that the barrier between us and ending AIDS earlier than now has been stigma and discrimination. We have been working hard for the last 20 years, but it's only now we are able to attain the milestone we were able to attain to identify close to 1.6 million people and put them on life-saving medication. It has been challenging and difficult because of stigma and discrimination. However, we have made gains, and we are still making gains. And stigma and discrimination is one of the things that we will vigorously fight in the next 2 years. When we see most of our programming, you will see that these are programs that will be centered at empowering the community, at empowering service providers, and enlightening people to know that if you stigmatize and discriminate, you help the virus, you don't help us. But we cannot end it if we don't put all our hands together. If you don't help us, there is no way, no matter how much government puts there to fight HIV and AIDS, HIV/AIDS will never end without the cooperation and the assistance of the general public. That said, the second aspect of the challenges we have is the challenge of funding. Currently, it's only the federal government that is putting much money on HIV programming nationwide, and this shouldn't be the case. We want to see the state coming forward. We want to see states occupying driver's seat. We want to see states driving the response. We want to see states articulating all these things that we are doing at the center and now being in charge and telling us about their state, not us telling them about their state. So that is why for the next 2 years, you will see this vigorous shift from service provision by partners to service provision by states. We'll make resources available to states, then we will see empowered states driving the response. Once we have that and our services are integrated from donor provider to now state provider, we will be in the best position come 2030 to continue to drive this trend and to tell the global community this is how far our program has come, and it has matured to the level now that you can trust Nigeria as a nation and you can make this money available to Nigeria, and the Nigeria decide on how this money is best utilized.
All right. Now, you mentioned something, and that's the matter of people hiding, because there is concern that although we might be making progress with ending HIV, AIDS as it is, but the infection, the trajectory with infection is still on the rise, especially for HIV. I am wondering how we are looking at tackling that. There are persons who might be hiding, who know that they have this virus and are hiding. Also, how much of a concern is this for you?
It's a concern, but however, the trajectories that you're talking about are the trajectories we have been looking at for the last 2 years. We've been looking at the actual number that people that really have the virus and counting them and making sure that we are right on the numbers. That is what has led to the decrease in the number of people that we now have on treatment, as against the 2 million that we were thinking at the end of last year. Now we have vigorously looked at our data and see there is a lot of double counting. Sorry, there were a lot of double countings. There were a lot of patients that probably have died and their name have not been taken off register. There are a lot of patients that have been taking medication in several places because maybe of stigma and discrimination, and their names are captured and they have not been taken out and they have not been counted as single person. They have been counted as multiple persons. So because of that, we got our figures inflated. On the side of new infection, the rise of new infection, we're looking at this number, and we will see by the time we finish validating the number, including the number that mother-to-child transmission that is happening in the country, we will come up with the right figure and the right number, and the number that will inform our decisions going forward. But it's good to say that these numbers are not increasing, but they are declining. They are declining because of the fact that people that have the virus are taking this medication, and the medication is helping to keep this virus within these people. And because they enroll in our program, they know more about our prevention program, they key into the prevention program, and they stop giving the virus to others. Our main concern and our main challenge now are the remaining people that are out there. They either do not know their HIV status, or they know their HIV status, but they are afraid to come forward and take medicine for HIV because somebody somehow probably will see them in the hospital queuing for HIV drugs, or somebody will get to know about their HIV status, that they're taking HIV drugs. And because of that, they rather want to continue to stay with the virus in them, and this virus wreaking havoc in their immune system, and then at the same time taking them closer to death. So these are the people that we probably at this material time think that constitute most of our challenge. They know about their HIV status, but they're not coming forward to take the medication, or they don't even know about their HIV status, and they are not willing to know about their HIV status. At the same time, they are high-risk takers. So these are the category of people that we are calling and trying to partner with to make sure that they know about their HIV status and they take advantage of the services we have. Thank you.
So how do you gather this data with the numbers? Because you said that you had to look at those figures that you had, interrogate them, and then you began to discover some of the discrepancies that you mentioned earlier. How do you gather this data? Talk to us about perhaps the age brackets that perhaps are dominating this numbers, because we need to interrogate it closely. There are concerns out there that we see a younger number of persons who are engaged in active sexual activity who are not taking these matters seriously.
Right. So generally, you see HIV thriving among sexually active population groups, and generally you think of younger individuals. And definitely because the younger individuals are a difficult, we call them adolescents and young persons. They're a difficult group to connect with simply because programs like this, they don't listen to it. They don't listen to radios. They are always in the social media arena. And if you want to get them, you have to use their networks of friends and network of places, platforms they patronize to get this message across to them. Last year, we partnered with the social media group, and we've seen changes, we've seen shift now in the where our service have been accessed by younger individuals. And we will continue to strive along this direction to make sure that we are bringing them onto our fold. Yes, HIV is spreading more among the younger population under the age of 25 years and among the key affected populations, those people who have sex, men who have sex with men, the transgenders, the sex workers, and above all, people who inject drugs.
Interesting. And I want you to expatiate further on what you did, because we just ended, maybe ended, or probably still in the air, the Valentine season, and you talking about the social media, the younger age bracket and the social media, you know, how they did things. I can remember what went on when we were in secondary schools, the way some of our colleagues were, you know, looking forward to Valentine's Day and all of that. What role did you play, your agency play during the season in stemming the tide of, you know, HIV and AIDS among them, especially the preventive measures?
Right. So, and we anticipate those kind of risk behavior during Valentine's period. And before that period, we usually have a press release. We had it this year. And virtually what we try to tell individuals, the message is that, yes, you can spread love, but be sure you don't spread HIV in the process of spreading love. Make sure that, you know, whatever risk you're taking is a risk that is protected, and you actually know the amount of risk you're taking, and you know that you have a responsibility to protect yourself and protect your loved ones. We have had some activities last week on the Valentine's Day, and most of them are preventive activities out in the community, making sure we provide access to HIV testing services for people to know about their HIV status, making sure we inform them about the availability of condoms and other preventive services that are out there in our community, and making sure also we inform the high-risk population, the younger ones that are having sex with men, the sex workers, the injection drug users, and transgenders, of the availability of what we call PrEP. These are drugs that are used by people that are not HIV positive actually, but they are at high risk of getting HIV, to prevent them from getting the virus, because daily they are engaged in activities that usually bring them closer to HIV. So to prevent them having HIV, they take this medication, and this medication prevents them from having HIV. But in the actual sense, they don't have the virus. So all these activities were out there, and were aimed to continue, not only during Valentine's Day, but continuously, you know, as we access the younger age group and this population, that they always tell us that no, that anything for us cannot be without us. So yes, this is something that we are giving for them, and we want to make sure we work with them to provide these services.
Interesting. I'd like to follow up on that. You know, you've actually mentioned men having sex with men, you know, more than a couple of times, and I kept wondering, you know, some of those who are in the vulnerable brackets, talk about the sex workers, talk about people with who actually inject drugs and all of that. Does that speak to the Nigeria stance against homosexualism? You know, of course, anyone found doing that is culpable for 14 years imprisonment. So are you in any way advocating against those who are especially coming out to say this is how they want to identify, you know, with their own sexual orientation? Are you saying that with those kind of people who have that kind of sexual orientation are going the wrong way in also especially spreading the scourge of HIV and AIDS, which is working or mitigating against your target of 2030?
We make people to understand that in every society, wherever you stay, whether you are in the United States of America or you are in Nigeria, there are always laws of the land, and those laws need to be respected. Whatever you do, you must make sure that when you break law, the law can come against you because you've committed an offense. At the same time, we have a very good understanding with the security agencies. We have very good understanding also with the communities that this service needs to access to. We realize that these are a key population group that must be accessed for us to stem the tide of the spread of HIV, because they are within us actually. They are not come somewhere where they have their activity and the general public has its also activity. No, we are all together and we are mixed. So because of that, we need to find a way of reaching out to this population group and providing this population group with the services without breaking the laws of the land, and ensuring that the laws are also respected. So this population group know that the fact that we provide services, the fact that we access where they stay or where they want us to provide services for them, that also does not give them the license to break the law. If they break the law at any time, the law enforcement agencies can come after them, and they are aware of that. So there were pockets of such kind of infractions, but I think their network is getting to understand that there is this need, to access the services, and there is also the greater need to abide by the law in accessing those services. And we've seen tremendous progress, at least over the last 8 months from the time when we had the last episode.
Now that we know the target population, especially of those who are affected by HIV and AIDS, what kinds of message are we tailoring towards these persons? Because there has been concerns with regards to the epidemiological terms and slogans used in passing across messages to these persons. Perhaps this is why these persons are not really taking these messages seriously.
I didn't get this question clear, but
the question is, there has been concerns or criticism around the kinds of terms and slogans used to pass across messages towards target population that we see have the HIV and AIDS virus, so to speak, and there are concerns with the kinds of messages, how it is being coined. And I am wondering, as we know this audience, this target population, what kinds of messages are we taking to them, and how far have we gone with reaching across to them with regards to the kinds of message and creating awareness in the course of this, looking at the target we are trying to get in 2030?
We approach this by educating the population, the target population, to know that there are stakeholders in ending AIDS, and there is just no way we can end AIDS without their cooperation. There is what we call now community-led monitoring, and community-led monitoring is essentially the network of people living with HIV/AIDS, and this includes the key affected population and the general population within their network, and this network is empowered nationwide to move in our community and in our facility, one, using people that are infected and affected to ensure that services are reaching where they needed to be reached, and people within the network are educated in terms of our prevention services and also the roles that we expect them to play, making sure that the services are provided and the services are up to the standard that is expected. And at the same time, their people are actually accessing and patronizing those services wherever they are being provided. And we've gotten tremendous cooperation with the network of people living with HIV/AIDS over the last 1 year. And the next 2 years, we'll see an era where there will be more empowerment in terms of educating this community and in terms of resourcing this community to make sure they are now gainfully engaged to go after these services and where these services are provided, making sure people within their network access the services, and also they help in identifying people, new people that have not been diagnosed in the past. And when they are identified, they also help in linking them to our care and support services wherever they are located.
Do these people determine how the messages are being tailored so that they don't feel that they are being discriminated against?
Yeah, these people have been trained and they have known about the languages and the messages that we sanction or we approve, and they are using this language and the messages, in terms of bringing people in onto the fold of the network, as well as aiding people to access the services that are available. This does not only stop with people living with HIV/AIDS, but it also include people in the general community that are yet not to know about their HIV status.
Let me quickly squeeze this in because of our time. Looking ahead, what key priorities and strategies would you say Nigeria should continue to focus on in order to, not lose a track in ending the 2030 target of ending HIV and AIDS?
One, Nigeria is going to fight stigma and discrimination to make sure that people feel comfortable to come forward and access services, to come forward and know about their HIV status, and if they are HIV positive, they know where to take this medication. Over the next 2 years, you will see vigorous engagement of traditional rulers, religious leaders, political leaders, to ensure that no baby in Nigeria is born with HIV. We cannot end the AIDS without ending AIDS within our newborn. Thus, newly born with HIV are people that are expected to survive with HIV for the next 50 years or for the next 60 or 70 years without cure. If cure has not been found, HIV will continue to thrive in this population group and among these people, and you cannot guarantee that they cannot continue to spread HIV. We will also focus in making sure that this program is owned by the country. There are states that are involved and the states are engaged and they are driving the responses. And people are now having these services at the community level, at the doorstep, at the primary healthcare level, where other services are also provided. So this is what we call service integration. And there will be more of service integration going forward. And as you must have heard, that there is now the unlocking. The president has appointed a coordinator to unlock the health value chain. And so that unlocking will now enable Nigeria to manufacture commodities, to manufacture drugs, to partner with companies that have been in this process of manufacturing drugs and manufacturing kits and manufacturing consumables for HIV to come into our country, manufacture for our country to participate in the manufacturing, for our economy to grow, and for us to have easy access to these commodities, unlike the issues we have had during COVID-19, where we have commodities somewhere, but bringing them into the country, took us several months because the entire supply chain globally is disrupted. If we have this manufacturing in our country taking place, we will be at home anytime when these commodities are trucks and move them to where they are needed.
Dr. Gambo Aliyu, Director General of the National Agency for the Control of AIDS, thank you so much for your time on the program.
My pleasure. Thank you.
Right. In our